Thank you, Tanya. And this is Ursula DeBerry. Sign name is this with the U on the lower chin. And I am the director for the Governor's Office for the Deaf and Hard of Hearing. Thank you for joining us. What I'm going to go ahead and start with, I'm going to go ahead and explain the uh, etiquettes of Zoom. Thank you. So this meeting is an hour. We have two interpreters that are joining us from Convo to support us for signing and voicing. This audience is mixed. We have deaf, hearing participants here. To prepare, if you plan on using your video, make sure that your eye level is actually in position with the camera. Background, make sure it's plain and no distractions. I did actually blur out my background, and now it actually looks blue. So I'm going to go ahead and describe myself. I am a light-skinned black deaf woman. I have my hair pulled up in a bun on top. I have black glasses on. I am wearing a cardigan, burgundy color, a white shirt. All right. And that's just going to be mentioned once. And if there's any comments or any questions, please raise your hand first before go ahead and stating whatever you wanted to share. Make sure that you do mute yourself if you're not talking, or if you actually wanted to go ahead and state anything, you will have an opportunity to share something in the meeting later on, and then you go ahead and just unmute yourself, and the interpreter will sign for you. Make sure you do raise your hand, and I will acknowledge you. If you want to go ahead and test that mechanism, go ahead and test it at this time. If you're not speaking, I ask you to go ahead and turn off your video. Those that are not speaking or presenting. Now I'm going to go ahead and turn off my video, and I'm going to go ahead and turn this over to Damien. And please make sure that you always give a few seconds prior to you speaking, so that way the interpreter can go ahead and finish voicing or signing. Meaning if you're talking and the interpreter is signing, wait until the interpreters put their hands down, then you can go ahead and respond. But if you're talking at this, it's like the same concept of when you're talking, when you're speaking, you don't want to overlap when spoken terms are happening. Okay. All right. Perfect. I look forward to seeing what you all learned from today.
Hey, hello everyone. I'm going to be using my voice today. Hello everyone. My name is Diamond Halliburton. I am the administrative assistant for the Governor's Office of the Deaf and Hard of Hearing, and I'll be leading today's presentation. Tanea, if you could come back on screen, I'd like you to introduce yourself as well.
Hi. My background is orange brown. I'm wearing a gray shirt. I'm using glasses. I have my hair is in a bun. My name is Tanea Brown. I'm an outreach coordinator.
Thank you, Tanea. And as for my description, I'm a Black woman with glasses and curly hair. I have on a blue shirt and a gray cardigan. All right, and with that, I will get us started. So we do have a PowerPoint presentation today. I am happy to share it with you if you'd like. And before I show that, I do want to recognize our sponsor here today, Delegate Bagnall and her staff. Thank you for being here. We really appreciate your presence. Okay, so here we have our departmental concepts for the legislative session of 2027. So our agenda today, we did the welcome. We're going to go through just our mission, our vision, our purpose, and some of the reasons why we're here today and the concepts that are related to those reasons. We are also going to do a quick overview of what other states are up to as well. And then we're happy to hear from the sponsors. Okay, and with that, I'm going to turn it over to Tanea.
Hi there, this is Tanea. Okay, so the mission of this office for the governor's office for the deaf and hard of hearing is representing Governor Westmore. And their primary Miller, Miller administration, that is the mission at this point. Next, please. What is our vision? That all Marylanders that are deaf, deaf-blind, hard of hearing, will have equal access to resources, services, and opportunities as a whole, full scope in all different aspects in community life. What's our purpose? Is to improve communication access, language equity, accessibility for the deaf, deaf-blind, hard of hearing, Marylanders. When interacting with state associations, local governance, healthcare providers, publics, different associated programs. Ursula here signing. This problem statement actually helps us guide into this presentation. Deaf and deaf-blind and hard of hearing Marylanders still continue to experience barriers here. And those barriers are done through government services, healthcare, emergency communication, public programming, and the constant hindering with equal access to communication and services in regards to service providers. I can give you an example here. While I'm in a public place, the law states that if a deaf or deaf-blind or hard of hearing individual wants an interpreter is asking for closed captions, asking for clarification. So if the individual is looking for closed captions in that place, they have the right to ask them to turn on the closed captions. That business, that facility should honor that request. But sometimes we still find ourselves in those challenges out there. Thank you. Next slide, please. This is actually more in depth of a current situation here. It includes delays. I'm going to wait for the interpreters to switch.
It includes delays, and our current challenges are significant, such as the delays in getting interpreters, getting an interpreter in person, that can be quite challenging. The limit availability of CDI, certified deaf interpreters, and an appropriate interpreter to match the client's needs. A lack of communication access, planning by public agencies, inconsistent use of accessible technology and how we use that, limited accountability and data collection, Also, access to requests and outcomes, materials on websites for state agencies and departments, and receiving information when needed. Sometimes when we do get information or data, we're uncertain if they're deaf or which community members are included. So we do need to separate those needs within our diverse communities uh, regarding the data that we do receive and collect. Materials on websites for state agencies and departments. They tend to be in English format. We do need to see more accessibility and use of ASL in those areas and have ASL inserted appropriately. And also protactile interpreting for deaf and blind. Thank you.
Okay, this is Diamond speaking. So now we're going to talk about the proposed legislative concepts for our office. So I do want to preface this by saying these are only concepts. We do have to go through our deputy legislative officer before anything is confirmed for our official departmental proposal. But um, I'm glad you're here today to give us the feedback or any additional concepts you may have for us. So, just an overview, we have Deaf Awareness Month, a language service fund, and a deaf-blind centered bill focused on support service providers. So first we have Deaf Awareness Month. Every year, our office submits a proclamation request to recognize September as Deaf Awareness Month. But this legislative session, upcoming session, we want to permanently recognize Deaf Awareness Month. This is especially significant since this year we are celebrating 25 years since the office was established. So I do believe that it's important that we build on the milestone and just keep going up from there. So Deaf Awareness Month is, I believe, I will personally one of the things that I'm really excited about. And I'm sure many other people will be too. Next, we have the Language Service Fund. So I know there are plenty of grants related to language services, but I have a little bit more about my role. I man the front desk. So when we get calls, I'm the person who answers them. And what I've been seeing is a lot of people trying to get doctor's appointments, just regular appointments, not emergent hospital visits, but a regular scheduled doctor's appointment. And they'll go after requesting an in-person interpreter only to find that there's only a computer screen with an interpreter on it. And while this may work in other cases where they didn't request an in-person interpreter, specific instructions given to the medical provider to provide an in-person interpreter has been a big issue. So it leads to rescheduling and delayed medical service. So I've seen this with regular medical facilities as well as nursing homes. So the vision for this is to have a fund that medical practices, private practices, and nursing homes can apply to cut out the costs that hinders people getting their services or their needs met. And I'm happy to answer any questions about that later on as well. And then next we have support service providers. So at the moment, our support service providers for the deaf blind is under DOORS, the Department of Rehabilitation Services. So this is a topic that we're actually still researching, but that we are very interested in expanding and improving. So we do have conversations in progress with representatives from DOORS and from the Telecommunication Access of Maryland under the Maryland Department of Disabilities. So this is something that we're hoping to improve, um, just so that, sorry, I'll give you a little bit more detail. We want more insight on when people can request these services. Right now, it seems very limited to exactly when a person can request a service, whether it's only for medical services or maybe they want to go to a community event. What is the process and how can we um, just make the program more inclusive in more ways? Um, and then some notable mentions are LEDK. I know Delegate Bagnall is here. Thank you again for joining us. Um, I did reach out to Delegate Bagnall, and I believe there are more conversations coming up about LEDK, so we are going to table that discussion. And another notable mention is the open captions bill, which we are still waiting to hear more on that to see if it will be introduced next session. And that will be all for our legislative concepts. So this is just an overview of the sponsors and stakeholders that we're in communication with, just to give you an idea. And we're hoping we'll be able to work with everyone again this coming session. And we are definitely open to partnering with more people, more sponsors, more stakeholders, if you have any suggestions. And for this, I will turn it over to Director DeBerry.
Thank you very much, Diamond. I have contacted other state agencies who do have deaf and hard of hearing offices, commissions, or that are similar to our office. I have had 30 replies. In Virginia, they focus on updating their language and their terminology. So they would like to work on that. And for the SSPCN and Deaf Mentor program, to continue to work for permanent, avoiding reliance on the biennium budget language. And number three, to reframe the Virginia Relay and equipment distribution. So there will be a program there of information and communication technology to be proactive with that from analog to digital. And to make sure that that analog to digital transition does stay relevant. We will continue to keep up to date with their progress. And on the next slide, I believe I will turn this over to the next presenter who will speak on New York. Thank you. Hello, this is Tania. New York, you'll see there's a lot of information listed here for the 25th session, a lot of information there. And then also on 2026, we have the two columns of information listed and also the legislative program. So for 2025 session, there were lots of successes. We submitted proposals to the governor. We were successful in having lead K passed and also LEADK for the state, helping to improve ASL access through state leads and also supporting the creative keys for the disability and assistive just one more, access law, specifically to include ASL. And also, we're going to be focusing in 26, developing for the state a proposal for the governor's consideration. So those proposals will be a priority, such as education, equity, language access, and we will continue building towards this success and what we've worked on previous years and continuing to improve across all of New York State. For the legislative program and priorities, we'll be focusing on health, language access, early intervention services, work group development, and key initiative to include codifying ASL access into the state law as an early intervention and having funding with Lead K.
Implementation.
Implementation.
Okay, the interpreters are going to switch. Okay, perfect. All right, DeBerry, you had your hand up. Thank you. Thank you, Tanea. Okay, I did want to clarify here. Now, for the expansion of lead K, when you were assigning this sign, that actually meant strengthen, not health. So just want to clarify on that part. For strengthening the language. Thank you. Thank you, Ursula, for clarifying on that. Okay. Hearing aids that actually are dispersed through programs work facing a shortage of interpreters, and that's through data collections, fellowship opportunities, support for other trainings such as pathways and so forth, a global effort to improve the outcomes in terms of accessibilities for deaf, blind, and hard of hearing New Yorkers within the lifespan. So that was actually what was the concept and the consensus of the proposal that was held previously and going forward. Okay, I think we're ready for the next slide. All right, comments? Ursula here. One, two, three. Yes, I could actually help with this part in regards to comments. I'm going to go ahead and turn the comments over to the sponsors. Is there anything that you would like to go ahead and mention about what you're doing for legislative session 2027? or any questions in regards to this presentation thus far? Oh, you know what? Yeah, it looks like Heather, you're muted.
Yeah, I don't have any questions at this time other than we continue to be committed to advancing language acquisition.
Thank you. Thank you, Delegate Bagenal. Okay, any other questions? Any other comments? No? Okay. All right. Well, then I will go ahead and turn this back over to Diamond.
Hey, Diamond speaking. Well, that is the end of our presentation. I do want to say that our concept is going to be due June 26th of this month. So if you do have any additional information you'd like to share or any other ideas, happy to hear them. But our concept is due on the 26th. And then our official departmental memo after it goes through our DLO will be due August 28th. So we're happy to hear from you guys before then. And then that is all. Thank you so much for joining us today. We really appreciate your time. Okay, and we're just going to close out for today. Have a great afternoon, everyone.